So welcome, my name is Mariana Herrera, and I put this presentation together with my wonderful classmate, Erin Hui, whom I love working with. And we worked on directive cognitive behavioral therapy, also commonly known as CBT, for our individual counseling class with Dr. Mueller. So let's get started. So what is cognitive behavioral therapy? The focus of cognitive behavioral therapy is changing automatic negative thoughts that can contribute and worsen emotional difficulties, depression, and things like anxiety. So it's really shifting the person's mind and changing their paradigm. I love that terminology because I feel like it's very appropriate for CBT. It's really changing the person's paradigm through their thoughts and actions. So in cognitive behavioral therapy, there are key factors. There's a clear connection between cognition, emotion, and behavior, how we view the world, what we feel, and how we act and how we think. It's very attractive to a lot of people because it's a short-term treatment approach. And homework is a very essential part of the treatment. The client really has to do the work at home to practice the techniques and conversations when situations arise. That's really, really important. And I'll give some reasons why in the next slide. So what's the connection between cognition, emotion, and behavior? Well, manage symptoms of mental illness. These are some, but the list is very long. Erin and I were thinking, okay, these sound like really good ones, but there's more. Identify ways to manage emotions, learning techniques for coping with stressful life situation, treat mental illness when medications aren't a good option. We also found that in some research, some people actually combine nowadays CBT and medication. And some people that the medication didn't work at all go to CBT and it works for them. So every case is unique and different, but research has, this is a research-based type of therapy that has shown to help a lot of people, overcome emotional trauma related to abuse or violence. So it's a very long list, but these are some of the items that we decided to include to give examples of the connection between cognition, emotion, and behavior that is essential for CBT. And here. So the mental health disorders that may improve with CBT, again, the list was really long, but these are some examples that we thought, okay, these are, common things that we hear about more and more nowadays, that mental health issues are hopefully becoming less of a stigma. These are some that are very common, but again, the list was really long. It was kind of hard to choose, right? So anxiety disorders, PTSD, sleep disorders, obsessive compulsive disorder, bipolar, substance abuse disorders, depression, of course, and so forth. One of the things, like I mentioned before, is that, the short-term treatment approach is something that is very attractive to people. Typically, it's between 6 and 20 sessions. So CBT really helps folks become aware of inaccurate or negative thinking, so you can view challenging situations more clearly and respond to them in a healthy and productive way. Like I mentioned, CBT homework is super important, and they are a central feature of cognitive behavioral therapy since 1970s. So that's really interesting, right? A little bit of history. This type of approach isn't new, but of course it's evolving like a lot of things, and that's the wonderful thing about psychology, right? But it's been around for a while, and homework assignment has been central, and this is since the 70s. Homework also may reduce the number of total sessions with a therapist because the individual will start being a little more independent and knowing how to respond to the triggering situations that they have to confront. Homework also provides the opportunity to transfer the different skills and lessons learned through therapy to contexts and situations and problems that may come up for the individual, the client. So, these opportunities are really good to translate the principles that we learned during therapy and to ensure that, okay, this intervention is really working, for the intended effects. So, as I mentioned before, CBT is a research evidence-based treatment. So this means that it's proven to be effective, which is great. And, it's really based on what we think and what we do can influence how we feel. And that is the basis of, and put in very simple words, right? So we decided to put this example. If a person breaks up a relationship thinking no one will ever love me again, the person will be, putting this thought in your head is going to materialize into your actions and how you go about the world. So it's about changing that paradigm and shifting that mindset. The person will feel less likely to go out and meet people, and over time they will become isolated and depressed, and really believing that that is true. No one will ever love me. Everyone is deserving of love, right? But there's certain actions that we have to put in place and certain mindsets that we have to change to open up to love, right? So it's a very simple example, of course, but we really liked it because it really illustrates this in a very simple way. And my parrot agrees with me, Limon, that's her name. So in CBT, the individual practices new ways of thinking and approach and viewing life, but of course, guided by a trained therapist that teaches the individual how to change his or her thoughts. This is really interesting because Erin and I were reading recent research that talks about, how thought deletion is very difficult, but therapists use a lot of thought substitution, right? So if we're like, I don't want to think of elephants, I don't want to think of elephants, and you're thinking of the elephant and you're telling yourself you don't want to think about it, you substitute that thought with another one. That also has proven to be more effective. It's like, we're not necessarily deleting this thought because that's very difficult. Even the thought of, you're trying to think not to think about it, you're thinking about it, but substituting that thought, and how are we going to accomplish that? So numerous research studies, suggest that CBT leads to significant improvement. And that's why a lot of people lean towards this. When medication isn't working or a sort of combination, every individual is different. We must talk about, the limitations. Everything has a limit, but so the time constraint used in schools, and, CBT within the ethnic and racial minorities requires more research, particularly in the areas of evidence-based treatment. But I think that that's the beautiful thing about psychology, is that it just keeps evolving and improving, right? Our methodologies and what we want to do and how we want to help people. So I think it's great that, we're talking about limitations, but it's good that we're not only talking about them, but there's people out there actively doing research to better practices. So I think that's wonderful. Another set of limitations is finding a therapist, and then within the school district or an outside referral. Of course, you can get a referral from a doctor, health insurance plan. This one's particularly I've seen from experiences in special ed teachers, sometimes with the health insurance and students trying to get those outside services. It depends on the health insurance. Some health insurances are not good with mental health services, and that's very unfortunate and something that we need to advocate for. And even the health providers are kind of like with their hands tied sometimes, so that can certainly be a limitation. We've seen this, right? But some employers offer counseling services or referrals through employee assistance programs. So it depends, but it's also having this information and knowing, right? Like, oh, your employer, has this assistant program that you can use, but some don't. So it's also sometimes a matter of the services are there, but we don't have the information. So that could be a limitation. But it's good to recognize these limitations so we can go ahead and fix the situation, right? So it's always, I try to look at the positive, like, okay, these are the limitations. How are we going to change this? And these are our references. So We really hope that Dr. Mueller, you enjoyed this presentation and it was great working together. So thank you so much.